In America, there is a rising amount of drug overdoses every day. The stigma of addiction and those who reach out for treatment traps individuals who use drugs into a cycle of addiction despite wanting help. As a nurse, it's part of our due diligence to educate the public when needed, and in this case, it would be necessary to educate in regards to the fact that addiction is not oftentimes as simple as a choice, but rather a mental illness that requires treatment. Sometimes detoxing can even cause such severe medical reactions such as seizures or even possibly death. This is another reason why safe injection sites are needed in America. The website of American Family Physician, AAFP.org, states that, quote, the number of annual overdose deaths increased by 37% to more than 96,000 from 2020 to 2021. Overdose deaths are so high that the U.S. Department of Health and Human Services has introduced harm reduction initiatives that have historically been controversial. Needle exchange programs to slow the spread of bloodborne diseases, and provision of fentanyl test strips to help people who inject drugs identify contaminated street drugs. So why not take it a step further? End quote. So why not take it a step further to really identify and support the need for addiction treatment in America by implementing safe injection sites? Another article, this time from NPR.org, titled, What's the Evidence That Supervised Drug Injection Sites Save Lives?, states that a supervised injection site based out of Vancouver, quote, averted about 50 deaths in the first 3 to 4 years of operation, that people were less likely to engage in behaviors that would lead to HIV infections, and that those who use Insight were more likely to initiate detoxing from drugs and access treatment like methadone compared to those who weren't using the facility, end quote. An important piece of information lies in that quote, and it has to do with the fact that there is an intervention in place for the needs of the patients. It's not just providing a place to inject, it's preventing death, and it's providing a resource of rehabilitation to those struggling with addiction. In this scenario, there are medical health personnel that staff these facilities that they see the individuals who use drugs as patients and are in need of care. Whether these patients accept or decline the care is entirely up to them, as with any other treatment. In many safe injection sites, they do have to agree to a certain level of care to be allowed to use the facilities, such as the consent to be Narcan if they do overdose. However, the effectiveness of safe injection sites does not only belong to the individuals who use drugs. An article from 2022 by Landenberg et al. States that their systematic review has demonstrated, quote, the effectiveness of SIF's safe injection sites in reducing overdose mortality and frequency, as well as improving access to addiction treatment. These outcomes were observed with no increase in crime and drug use-related public nuisance. In fact, several included studies in this review documented decreases in crime following the opening of the SIFs, end quote. This is the solid proof that implementing safe injection sites in America, such as they have done in Canada and Australia, would reduce unnecessary death, provide accessibility to addiction and mental health services, and promote the recovery of those who use drugs. It also benefits the public surrounding the site, and for this reason, you should vote affirmative to the proposed safe injection sites in America. Thank you.